So what's the state of the ACO market in 2016? I was thinking about this the other day. Do you remember the movie, The Wizard of Oz? And there's the yellow brick road that Dorothy and her friends go on. It's a long and winding road with ups and downs and starts and stops and challenges, obviously, and adventures. Well, that's kind of like what the accountable care movement's going through, a long and winding road. You know, there are over 430 Medicare Shared Savings Program ACOs. That's the good news. But the bad news, 95% of them are on the upside-only model. Then there's the Pioneer ACO program. It started with 32 participants, and every year it's been going down. Now there's only 9 remaining, and about half of those are applying to be next generation ACOs. The next generation ACO program has 18 participants, and I think there's at least 50 people who are trying to apply for the next year, which is good. And then there are Medicaid ACOs. 22 states either have a Medicaid ACO or are pursuing creating one. And then we don't want to forget the commercial ACOs. The latest estimate I saw was there are over 800 of those commercial ACOs. Now, the moment of truth, the turning point, is going to be when the majority of these ACOs take on full financial risk, both upside potential and downside risk. And when that happens, the Emerald City will be seen, and that's going to be accountable care for everyone. You know, in the ACO world, Medicare and commercial ACOs tend to grab all the headlines. The media love them. But there's a quiet revolution going on with Medicaid ACOs. You know, there are 14 Medicaid ACOs today, and there are another 8 states that are trying to build these and create these. Now, why are they doing that? There's 72.5 million Americans who are on Medicaid. We spent over $500 billion last year, the federal government and the state governments combined. And guess what? 50%, I heard this the other day, 50% of all births in the United States are into Medicaid families. It's a staggering figure. So as a result, the Congressional Budget Office estimates that Medicaid spending will go up faster than the gross domestic product of the United States. States know about this increased spending, and states have limited budgets. So what are they doing? They're trying to apply the accountable care concept to Medicaid. And the granddaddy of them all in this space, it's only been around for 5 years, but it's the most significant one, is the Colorado Accountable Care Collaborative, or ACC. There are 900,000 enrollees in that program. That's 70% of the Medicaid population in Colorado. And guess what they've been able to do? Each year they've been able to grow the program, and they've been able to reduce costs. Their last fiscal year, they saved a net amount of $37 million. So Colorado is really the pace setter when it comes to accountable care for Medicaid. You know, sometimes reality gets in the way of theory. The theory went that if we provided electronic health records and digitized all the health information, we'd be able to have value-based care and share the information freely. But something happened. David Blumenthal, who's the former national coordinator of HIT, famously said that he envisioned an electronic circulatory system that nourishes the practice of medicine, research, and public health. As a result of that, CMS gave $26 billion in incentive payments for electronic health records. But along the way, there were some actors in this ecosystem that prevented the sharing of information. They engaged in what's called data blocking. Earlier this year, ONC and CMS both lamented the fact of a lack of a digital dividend from EHRs. And they said we need to challenge the industry to embrace interoperability and be committed to it. So they launched what's known as an interoperability pledge. The interoperability pledge basically says we agree that we're not going to get involved in data sharing, and we're going to share information and support and accept these industry standards. Well, that pledge is a piece of paper. Let's hope that it's not just rhetoric, but it's really a reality. And if so, we'll recognize that interoperability is not just an idea, not just a nice philosophy, but essential for value-based care.